So there is a recall communications. I'm discussing again. Come on 2021. That is task is that explain ADHD. Attention deficit hyperactivity disorder to a fourth year medical student. Background is that Adil, he is a 2 years old boy, presented with challenging behavior, kicking, biting tantrums. Mother is divorced. She's working full time. She used to leave her son with grandma, who says that Adil is good and polite boy. Question: what is ADHD? Methylphenidate rule. Then acute emergency, can challenging behavior progress to ADHD? These are the questions. So first ADHD I am discussing. As usual, IRCAP, introducing myself, making the report, taking the consent, and I will telling the agenda of my communications and also the prior knowledge. So in medical student, we are asking the questions one by one, and the medical um, student will be answered this. Okay. So first, what is ADHD? ADHD is an integration of the three circles, that is hyperactivity, impulsivity, and poor attention. Remember, hyperactivity, impulsivity, and poor attention. Hyperactivity, what is? That is, mother feel that this child is driven by motor, cannot play quietly. So mother think that the child is cannot play quietly. Impulsivity, he fails to wait his turn. He is not thinking before acting, interrupt other conversations. So he fails to wait his turn and he interrupt other conversation. And if you ask, like in class, the teacher ask any question before ending, he answered that. Poor attention, he cannot finish his task, easily distracted. So these are hyperactivity, impulsivity, and poor attention. So hyperactivity is cannot play quietly. Impulsivity is that is cannot wait his turn, interrupt other conversations, and poor attendance, really easily distracted. Adding to this, he has also some problems, like he has difficulty in getting friends. He cannot estimate the time. For example, if his mom told him this bus will be here in 5 minutes, he cannot estimate this time. It is really difficult to organize the sequence of events. These have to be going one or two occasion at least. Okay. We cannot diagnose ADHD before of age unless there is family history of ADHD. So again, the criteria already told you, and also adding some problem. What are the problems? That ADHD patient has difficulty in getting friends. He cannot estimate the time. For example, if his mom is told him the bus will be here in 5 minutes, he cannot estimate this time. It is really difficult to organize the sequence of events. This have to be going in one or two occasions at least. So one or two occasions. We cannot diagnose ADHD before of age unless there is family history of ADHD. Now, what are the treatment of ADHD? That is number one, behavioral therapy. It is the cornerstone of the treatment, working with the child and the mother. The medications only above 6 years of age, that is methylphenidate and dexamphetamine that stimulate the areas responsible for concentration and self-control. Stimulant drugs contraindicated in cardiac patients. So again, I am telling the treatment of ADHD. That is first, it is behavioral therapy. That is the cornerstone of management of ADHD. Behavior, we will work with the child behavior and the mother. And medication only we give more than 6 years of age. That we are choosing. Number one is methylphenidate, and number two is dexamphetamine. And these are stimulate area that are responsible for concentration and self-control. Stimulate drug. This drug is contraindicated in cardiac patient. Now, mother may ask about the dexamphetamine. Is this drug like speed or ice? It is the same chemical substance, but it is given in adequately calculated dose, non-addictive. So it is not addictive. It is calculated we are giving. Is there any relation between ADHD and food additives? No. Is there any relation between the ADHD and sugary foods? Sugary fluids. Actually, sugary fluids will boost the level of activity of the children, but not causing ADHD. So no any food additives, no any sugary fluid causes ADHD. What about fish oil? Mother can try it, but there is nothing proven it contraindicated in fish allergy and not to be taken with anticoagulants. He will grow out of it. Some children grow out of it, some children do not. According to how severe is the disease and how early we start the intervention and how he responds to the intervention. So what about the prognosis or grow out of these conditions? Some children grow out and some children do not. It is dependent according to how severe he is affected with the disease. Early we start the intervention, then he respond to be the interventions. Will he need special school? Most of the time, no, but according to his conditions. And our case was 2-year-old Adil. That is keep through the kicking, biting himself, and another others he's calm when with the grandma. That is one kind of challenging behavior. So all features of ADHD I read on internet and present in my child. We are not sure about the diagnosis of ADHD below 5 or 6 years. Also, he has this behavior only at home. Are you sure that my child is not 100% ADHD? No, I cannot guarantee. What is challenging behavior? Why he has this behavior? Feeling unwell as when he is sick, lack of communications at this age to get attentions and maybe way of expressing his needs. So this type behavior, challenging behavior, like he's calm in grandma house and other he is like kicking, biting himself. He's feeling unwell is when he's sick, lack of communication at this age to get attentions and maybe way of expressing his needs. This is way of expressing his needs. He want attentions. I heard about Ritalin. Could we use it for my child? Is this behavior grow out of him? Is modifying the diet change his conditions? How could I deal with my child? So there are lots of questions. Answer is try to be calm as much as possible. If you appear anxious, he will escalate. Not to be attentive with him during doing this behavior, make a distraction. Praise positive behavior, take him to calm environment, try to be simple as much as you can, not dealing with much talk and high tone voice. If head banging, ensure safe environment. So what are the minimum step the mother can be take for a challenging behavior? That is, try to be calm as much as possible. If you appear anxious, he will be escalate. Not to be attentive with him during doing this behavior. Make a distractions, praise positive behavior. Take him to calm environment. Try to be simple as much as you can, not dealing with much talk and high tone voice. If he head banging, ensure safe environment. No medical treatment for this condition. No need for medical treatment. Does he need psychiatrist? No, it is a normal behavior. So challenging behavior is a normal behavior. The our task that medical student comes, the 2 year old child, he has challenging behavior, kicking, biting, tantrum. So we'll discuss that. What is challenging behavior and what is ADHD, and also the question what is ADHD. We know hyperactivity, poor concentration, and impulsivity. These are the triad methylphenidate rule. These are we tell. Is that can challenging behavior progress to ADHD? There is no guarantee. We tell that. So this is all about this communication. Thank you very much.